Hey everyone, so today we're gonna be reporting about the endocrine or the metabolic disorder. I am Raben E. Vasquez and my co-reporter is Miss Josephine Suan. And let's start. So the endocrine system is composed of small ductless glands that work together with the neurologic system to regulate and coordinate all body functions. They secrete hormones, and the action of the hormone is to turn off or turn on various organ functions. The hormone comes from the Greek word hormone. I don't know how to pronounce it correctly, but this is the spelling, which means to set in motion. Each gland of the endocrine system acts on a specific target or designated organ or has specific duties that are necessary for regulating body processes. So the endocrine system, also called the hormone system, which composed of glands that secretes hormones that play a role in our body's control of the homeostasis or the equilibrium. Then this is the endocrine system. Then the definition of the endocrine or the metabolic disorder. This is the inadequate secretion of hormones or dysfunction of the glands, which results in a variety of disorders that most of which have long-term implications. The endocrine and metabolic disorders as a group commonly cause changes in growth and child's social and physical development and may impair their cognitive development. Then for the assessment. When a child's height and weight are found to be above or below the typical measurement for their age, an acute loss in weight could be a sign of type 1 diabetes mellitus in children, and for the thyroid deficiencies or the type 2 diabetes mellitus may reveal that the child is being overweight. Pituitary difficulties may reveal unusually short or tall statured. A child with increased thyroid hormone production may be unable to sit quietly at all. Then extreme thirst or appetite may occur, and endocrine disorders such as diabetes insipidus or type 1 diabetes mellitus. Frequent voiding may suggest urinary tract infection or the excessive urine excretion or the polyuria, possibly from pituitary dysfunction or diabetes mellitus. If the skin is cool to touch, it could be a sign of hypothyroidism. If also the hair is brittle, the fingers are trembling, could be a sign of hypothyroidism. And if the face round with hair growth, could be a sign of Cushing syndrome, or the excessive growth of hair on the body, which is the so-called hirsutism, especially in girls. Then, if the mouth is a delayed dentition, could be a sign of hypokalemia or there is a decreased production of calcium or inadequate calcium. Then, if there is enlargement of the anterior neck, it could be a sign of goiter or the hyperthyroidism. Then, for the signs and symptoms, a child's general appearance may reveal early or late pubertal changes, scaling or drying or darkening skin, the drooping eyelid, protrusion of the eyeball or the exophthalmos, then the poor muscle tone. Then for the management, education and genetic counseling are important preventive measures, and school nurses also can be very instrumental not only in counseling but also in serving as an advisor to what foods and snacks ought to be available in school setting. Kung himo sila ang say dapat available ay nga canteen baron for the promotion of health for the children. Then the disorders of the Let's move to the disorders of the pituitary gland. But the pituitary gland is directed by the hypothalamus. It is an organ located in the center of the brain that is the regulator of the autonomic nervous system. The pituitary rests in the solartergica, a depression of the sphenoid bone. It is divided into several distinct regions: the anterior lobe or the adenohypophysis, the posterior lobe or the neurohypophysis, and the intermediate lobe or pars intermedia, which lies between the anterior and the posterior lobes. So the common pituitary hormones and their purposes. The gland secretes antidiuretic hormone or the ADH. It is secreted by the posterior lobe or the neurohypophysis. The target organ is the kidney. It helps regulate fluid volume by regulating urine output. By decreasing urine output, it increases the volume of extracellular fluid volume when secretion of ADH is low. Then the urinary output increases. Factors such as trauma, pain, anxiety, and exposure to high temperatures all increases ADH release. If you observe if extreme po na condition like rainy season, tugnaw ka adyo, then prone po ba nga even your child or we adults balik-balik sa CR kay magsig-ihi. So, ang responsible ang hormone is the antidiuretic hormone. If low ang secretion sa antidiuretic hormone, so urinary output mag-increase siya. So, if diuretic gani sig ihi, then if from the word itself antidiuretic, so iyang i-prevent ang sig ihi. Then for the corticotropin or the adrenocorticotropic hormone secreted by the anterior pituitary gland or the adenohypophysis. Target organ, the adrenal glands. It stimulates the adrenal to produce glucocorticoid. Glucocorticoid is a hormone that regulates essential body functions, and the mineralocorticoid hormone regulates salt and water balance. Increased production of adrenal gland secretion decreases ECTH production and vice versa. Then for the somatotropin or growth hormone secreted by the anterior gihapon, then target organ is none, then it acts on all body cells. GH increases bone and cartilage growth by increasing the gastrointestinal absorption of calcium. If GH production is inhibited or undergrowth will occur, or the so-called hypopituitarism or the dwarfism. Then if there is excessive production of GH hormone, overgrowth will occur. Thus, the hyperpituitarism or the gigantism exist. And for the last hormone, thyrotropin or the thyroid stimulating hormone secreted by the anterior lobe gihapon of the pituitary gland, and target organ is the thyroid. TSH stimulates the thyroid gland to produce thyroid hormone, the thyroxine or the T3, and the triiodothyronine or the T4. Too little TSH leads to atrophy and inactivity of the thyroid gland. Too much also causes hypertrophy. Then increase in size or the hyperplasia, increase in the number of cells of the glands. The T3 di ay kay ang triiodothyronine, and the thyroxine is the T4. Then let's move to the pituitary gland disorders. These are illnesses caused by the pituitary dysfunction. The risk factors include tumor growing in either the pituitary gland or the hypothalamus, interference with the circulation to the gland, then the trauma, inflammation, structural abnormalities, erratic or the non-functional feedback mechanism, and possibly from autoimmune disease. Muna lang ito, it can result to hypopituitarism or the lack of growth hormone, and if there is excessive secretion of growth hormone, could be hyperpituitarism nga nasa picture na kanang mubo mo siyang hyperpituitarism or the lack of growth hormone. Whereas ang kaning taas ka adjust dyan, mo siyang excessive secretion of growth hormone. And if naaga ni under secretion ang growth hormone, it could be a sign of the diabetes insipidus. Diabetes insipidus is normally kanang normal ra ang iyang glucose concentration, but ang na-defect niya is ang iyahang kidneys. Naabot to sa Guinness World Book of Records nga pinakataas nga tao, pero mo na specify kung kinsa to ang pila to ka height ijang kuan katasun. Then naapod pinakagamay. Then for the growth hormone deficiency, ano ni? Production of human growth hormone or the GH, somatotropin is deficient. Children are not able to grow to full size, according to Dorr and others of 2015. Then for the assessment, physical assessment, endoscopic examination, neurologic testing, and blood analysis are the wrist X-ray to find out if naabay lack sa ijang or decrease ba ang increase sa ijang cartilage growth. Then for the history taking, if naba sila kaliwat sa ilaman ng family history, child's prenatal at birth history, and 24-hour nutrition history, if to determine nga if pilian ba ng bata o unsa ba na nga kuan yung kanon makapromote ba sa growth niya. Then assess also for chronic illness, if naaba sa heart or kidney disease or something ana nga makapatrigger or prevent sa ijang growth. Then they are usually normal in size and weight at birth. Child begins to fall below the 3rd percentile of height and weight on the growth chart. If the child's face is infantile na siya din, infantile ka ng murag wa siya kadyo na fully developed. Infantile ka adyo. Bata kitaon, then because immature pa ang ijahang structure sa face. Then ang nose usually small, then kids' teeth may be crowded in small jaw and may erupt lately. Or agijang voice may be high-pitched, and onset of pubic, facial and axillary care, and genital growth will be delayed also. So further risk factors could be a tumor growing in either the pituitary gland or the hypothalamus, the interference with balik naman risk factor, decreased level of circulating growth hormone, could be genetic, or the non-malignant cystic tumor nga ni-occur sa embryonic origin that causes pressure on the pituitary gland, maka-increase siya of intracranial pressure, maulag itong sa ganina katong diri. Pwede siya ma-result sa trauma. Ito dire. Then for the management, intramuscular recombinant human growth hormone given daily at bedtime. At anong bedtime man? Kay diha nga time dira man ang peak sa pag-release sa hormone. Peak peak time siya dira siya agkuan taas. Then suppression of the luteinizing hormone, releasing hormone, or the gonadotropin releasing hormone. Suppress siya. And then other children also may need supplements of gonadotropic gonadotropin rather, or the other pituitary hormones if these are determined to be deficient as well. Also, caution pod dapat pod i-caution ang child nga ag paggamit aning drug dapat na sa medical reason kay kung mapataka ra og kuan og pataka ra og take ana nga drug kanang it could be very dangerous kay sometimes mo good ag uban kay ilarang kuan anang daghanon ra bitaw kanang excessive intake nila kay lagi kanang naa sila delayed kanang sa pag-growth nila. So if ma-overdose something ana kaya guban man gud nga athletes pod kay gamiton ra responsibly kay lagi para mo improve ilang muscle og overall stamina, especially those athletes man lagi. So dapat boost yung stamina. So mao na dapat dili kay potentially dangerous na siya if ma-excessive siya paggamit. So for the growth hormone excess, this is the overproduction of GH hormone usually caused by a benign tumor of the anterior pituitary or an adenoma. If the overproduction occurs before the epiphyseal lines of the long bones have closed, excessive or overgrowth will result. Okay, of course, before pa ma-close ag epiphyseal lines, it will have tendency nga mo-grow pa man. So, mauna nga mo. Ang uban over kataas, ang uban napoy over kamubo. Pero ang i-focus diri, excess man siya sa over. So, if there is an acromegaly, enlargement of the bones of the head and soft parts of the hands and feet begins to be evident. So, wala siya. Taas ra ang kanang kuan sa tiil kanang fingers o ang fingers sa kamot. Then, for the assessment, the tongue can become so enlarged and thickened that protrude from the mouth, giving the child a dull and pathetic appearance, making them difficult to articulate words ng uban magdisorigstorya. Weight will become excessive but is proportional to height. Napoy uban excessive ang weight but also mabagay ra pud sa ilang height. Then X-rays or ultrasound of the skull reveals the sila tracheca is enlarged or that tumor is present. Then for the management, if there is a tumor, a laser surgery or the cryosurgery or the freezing of tissues are implemented. Then if there is no tumor is present, JH antagonist such as bromocriptine parlodel taken orally and octreotide sandostatin via injection. If GH secretion is halted, child may need to receive supplemental thyroid extract, cortisol, and gonadotropin hormones. Then if ang permanent therapy, irradiation, or radioactive implants of the pituitary gland or the counseling. It might be too distressing to the children about their maintaining their confidence or their self-esteem, making the adjustments kay ang uban especially lahi malagit ang tao ang uban kay ma-conscious sa ilang height kanang basin mabuli sila nga taas ra kaayo sila something ana if sa ilang mga kaduwa kay lagi bata lagi also sa ila pong clothes nang dili na ma-fit nila. So dapat i-cancel pod nato, cancel pod ang management counseling. Then, for the diabetes insipidus, it is a disease in which there is decreased release of ADH. EDH or the katong antidiuretic hormone by the pituitary gland. This causes less reabsorption of fluid in the kidney tubules. This may reflect an X-linked dominant trait or may be transmitted by an autosomal recessive gene. So, lagi ito siya, lagi ni katong antidiuretic hormone, which is, ang target organ ato ni dya is ang kidney. So, bawal ito dyan, naanis, na mga ni uban pod nga sa mga bata nga kanang nag-ihi-ihi. Then, the assessment, polydipsia or the excessive thirst na siya, din na siya trait. Then, the polyuria, of course, if sikag inom mo sige po siya kag-ihi-ihi. Low urine specific gravity of as low as 1.001 to 1.005. Ang normal urine gravity values are between the 1.010 to 1.030. Then, irritability, weakness, lethargy, fever, headache, and seizures rather. Ang kaning disorder, parents may notice that polyuria first kanang mag-ihi sa banig bisag gitry na ang bata sa toilet, and weight loss pod kay because of the large loss of fluids. Then kuya po ni siya nga kuan disorder kay if dili ni siya mabantayan or if it remains unnoticed or kanang untreated kanang imurang gibaliwala, kanang the child may be in danger of kanang kay lagim sige ihi, so large amount of water ang malo sa body and it will lead to dehydration and could lead to death sa bako-bako. Then the management, surgery if tumor is present, and administration of desmopressin, DDAVP, and arginine vasopressin, emergency via IV if for long-term intranasally or orally. But if ang desmopressin if given intranasally, it may cause nasal irritation that will not be effective as the child develops upper respiratory tract infection and JAK. Kaya swell man ang iyang mucous membranes. So, for the syndrome of inappropriate antidiuretic hormone, it is a rare condition in which there is an overproduction of EDH by the posterior pituitary gland. This result in decrease in urine production. Which leads to water intoxication. Ang kani po siya, kuan pod kanang there is a decrease in kanang kabaliktaran sa katong usa kay ang kaning diabetes insipidus kanina. Sim siya ihi, ang kani po siya is lack po siya, magdi siya ihi. Then signs and symptoms, weight gain of course kay wala man siya malas sa iyang body or retain rat sa lawas. Then concentrated urine, increased hinon ang increased specific gravity sa urine. Then nausea, vomiting, coma, and seizures. Good seizures kay wala may gawa, so simba ko mo adto sa brain, then magka-cause of brain edema. Then for the risk factor, the bacterial meningitis, long-term positive pressure ventilation, pituitary compression from edema or tumor. Then the management, restriction of fluid and supplementation of sodium via IV if needed. Then cycline, demeclomycin. It is antibiotic na siya nga na side effect nga mablock sa antidiuretic hormones sa renal tubules. Nga mo magpa-decrease sa magpa-decrease or magpa-reduce sa resorption of fluid sa kidney. Then for the thyroid gland, the thyroid gland is located at the front of the neck, responsible for controlling the rate of metabolism in the body through the hormones T4 thyroxine or the T3 triiodothyronine. Then for the assessment, radioimmunoassay of T4 and T3, a specific blood study to determine how much protein-bound iodine is present in the serum. Then, radioactive iodine uptake test. Child is given an oral dose of solution containing radioactive iodine. The small amount of iodine present in the iodized salt dili na siya affect sa protein-bound iodine levels. But mao sila ang mga test na i-take. Then if the uptake of less than 10% of the test done suggest hypothyroidism, sa kani nga radioactive iodine uptake tests. Ang makakos sa kanang waiter is kanang lack of iodine in the diet. Then for disorders, the congenital hypothyroidism. Because congenital kanang nature na jud kanang from birth. It is the reduced production of both T4 and T3. It is an indication that the infant's thyroid is not functioning well. Risk factor white is more evident on infant girl. Ambot nga na wala siya specified diri, but more just siya on infant girl nga white than boys. Then low birth weight of 4,500 grams, low iodine level in the mother or autoimmune, antibodies across the placenta. Then for the assessment, a screening test for hypothyroidism. Hair is brittle and dry. Child's neck appears short and thick. Sa pictures, dull and facial expression, flaggy rhodal appearance, open mouth, extremities appear short and fat, decreased deep tendon reflexes, generalized obesity. Kay ang thyroid regulates the control of the metabolism of the body's metabolism. So if naa-sa dry dysfunction, makakausa dyan obesity or even over kaniwang. Then delayed dentition, enlarged abdomen. Because of the enlarged abdomen, then dapat dyan umbilical hernia, then poor muscle tone. The symptoms is apparent during the first 3 months of life if formula-fed infant, then about 6 months if breastfed infant ang baby. Then for the signs and symptoms, sleeps excessively, respiratory difficulty, kay lagi to ganina sa picture, kay ijang tang kay ni black man sa ijang mouth na maglisod o kinhawa. Then noisy respirations or obstruction. Then suck poorly. There is choking because of the tongue. Unusually skin is cold, dry, scaly, and does not perspire. Hindi panington. Then pulse, respiratory rate, and body temperature becomes abnormal. Then there are also prolonged jaundice or magilo. Then for the management, transient hypothyroidism usually fades by 3 months. It will eventually reside on its own. Then, oral administration of synthetic thyroid hormones, sodium levothyroxine. Supplemental vitamin D may be given to prevent the development of rickets. Then, period monitoring of T4 and T3. Then, for the acquired hypothyroidism or the Hashimoto disease, this is the common form of acquired hypothyroidism in childhood. The age of onset is mostly often 10 to 11 years. There may be a family history of thyroid disease and it occurs more often in girls than in boys. So, kaya nga disease, more on the girls, siya. For the risk factor, family history of thyroid diseases, development of an autoimmune phenomenon. And for the assessment, hypertrophy of the thyroid gland, goiter. Antithyroid antibodies will be present in the serum if illness is caused by autoimmune process. If nodes are benign, there is generally a rapid uptake of radioactive iodine, hot nodes. If there is no uptake, cold nodes, carcinoma is much more likely the diagnosis. Then for the management, the administration of synthetic thyroid hormone or the sodium levothyroxine, the same as the congenital hypothyroidism. For the hypothyroidism or the Graves' disease, it is the oversecretion of thyroid hormones by the thyroid gland. In older children, overactivity of the thyroid gland can occur from the glands being overstimulated by the thyroid-stimulating hormone from the pituitary gland due to a pituitary tumor. Hypothyroidism, hyperthyroidism in children is caused by autoimmune reaction that result in the overproduction of immunoglobulin, which stimulates thyroid gland to overproduce T4. Usually resolves between 3 to 12 weeks. Kasagaran ani, it will eventually reside. It will eventually resolve on their own. Then for the assessment, on X-ray, bone age will appear advanced beyond the chronological age of child. Swelling on the anterior neck as goiter develops. Then laboratory tests shows elevated T4 and T3 levels and increased radioactive iodine uptake. Then ultrasound will reveal the enlarged thyroid. And for the signs and symptoms, there will be nervousness, tremors, loss of muscle tone, and easy fatigue. Increased basal metabolic strength and increased blood pressure and pulse. Skin feels moist and they perspire freely, unlike sa katong hypo nga dili sila mo perspire. So feel hungry, do not weight gain and may even lose weight. Kaya lagi hyperthyroidism, increased production of thyroid hormones or oversecretion. So ang thyroid hormone siya kay nag-relate sa body's metabolism and development of the human body. Then eye globes become prominent or the exophthalmia. Ano siya ang signs sa hyperthyroidism? Ano siya makita sa ang child is like hyperthyroidism? Then for the management, the beta-adrenergic blocking agents such as propranolol. Then the child is placed on antithyroid drugs such as propylthiouracil or PTU or methimazole, tapazole to suppress the formation of T4. While the child is taking these drugs, the blood is monitored for leukopenia or the decreased white blood cell count and thrombocytopenia decrease platelet count. Side effects of the drugs nga i-administer to manage this kind of disease. Then, if the child has toxic reactions to medical management, mas severe, low ang ijang white blood cell count o platelet count or non-compliant about the medicine, the iodine ablative therapy with iodine or thyroid surgery to reduce size of thyroid gland. A supplemental thyroid hormone therapy may need to be taken indefinitely because the gland is no longer able to produce an adequate amount kay lagi. If i-reduce ang iyang size, so later po ang iyang capacity to function. Then for the remaining topics, it will be discussed by Ms. Suan.
So to continue our topic, we are now here at the adrenal glands. So two adrenal glands are located retroperitoneally just above the kidneys. So they are made up of two distinct divisions, and together they protect the body against acute and chronic forms of stress. So, naitulo ka hormones. First is the cortisol, a glucocorticoid responsible for glucose and protein metabolism and preventing inflammations. Second is the androgen, a steroid hormone responsible for muscle development. And the third is the aldosterone, a mineralocorticoid hormone necessary for sodium and fluid balance. So, disorders of the adrenal glands causes either hypofunctions, which can lead to acute or chronic productions of necessary hormones, or hyperfunctions or overactivity, which most often leads to overproductions of androgen or cortisol. So, we have here the acute adrenocortical insufficiency for the disorder of the adrenal glands. So, this is acute adrenocortical insufficiency is the insufficiency of the adrenal glands can occur in either acute or chronic form. In either type, the functions of the entire gland suddenly become non-productive. So usually, this occurs following a severe, overwhelming body infection such as meningococcemia. So, ingani siya og forma ang meningococcemia. So, it can also occur when corticosteroid therapy such as prednisone, which has been maintained at high level for a long period and then kalit lang nga stop, and the glands does not return to the usual functions of it. So for the assessment, child with adrenocortical insufficiency, so ang bata ani ang blood pressure mo ubos, and then children appears ashen gray, ang pulse will be weak, the temperature become elevated, then dehydrations and hypoglycemia. Child also appears in prostrate and seizures may occur. Without treatment, death can occur abruptly. So for the therapeutic management, acute adrenocortical insufficiency is a medical emergency. So treatment involves an immediate replacement of cortisol with IV hydrocortisone sodium succinate. The administrations of deoxycorticosterone acetate and synthetic equivalent of aldosterone and IV 5% glucose in normal saline solutions to restore blood pressure, sodium, and blood glucose level. And then, a vasoconstrictions may be necessary to elevate the blood pressures. Next is the congenital adrenal hyperplasia. So, congenital adrenal hyperplasia is a syndrome that is inherited as in autosomal receives the threat that which causes the adrenal glands to not be able to synthesize cortisol. Instead, they overproduce androgen. So for the assessment, excessive androgen productions during intrauterine life cause the genital organs in a male fetus to overgrow or increase in size. Then female fetus is masculinized. If the condition is not recognized and remain untreated, bone age will advise so that so the epicell lines of the long bones close early, preventing the child from reaching usual adult height. Public and axillary hair, acne, and a deep masculine voice will appear precociously. So next is no breast development or menstruation. And untreated boys at age 3 or 4 develops acne and a deep mature voice. Then public hair and still greater enlargement of the penis and scrotums and female infant with congenital adrenogenital hyperplasia. So next is the salt losing form of congenital adrenogenital hyperplasia. For the definition, if there is a complete blockage of cortisol formations, aldosterone productions will also be deficient. So without adequate aldosterone, salt is not retained by the body. So for the assessment, weighing infants at each child helps check up. Then boys with these syndromes appears normal at birth. Inability to gain back the birth weight may be the first sign of the syndrome. For the signs and symptoms, vomiting, diarrhea, anorexia, loss of weight, and extreme hydration. For the management, hydrocortisone supplementation, increased salt intake, DOCA, a synthetic aldosterone or long acting given once a month via IM. Then capsules of DOCA. And the next, as the child grows older, fludrocortisone, a mineralocorticoid may be given orally to aid salt retention. Next is the Cushing syndromes or Cushing-Hypoid appearance. So, is caused by overproductions of the adrenal hormone cortisol. This usually results from increased ACTH production due to either a pituitary or adrenal cortex tumor. So peak age of occurrence 6 to 7 years, but the syndromes can occur as early as infancy. For the assessment, the serum of the child with Cushing syndromes reveals elevated plasma cortisol and increased urinary free cortisol level. So next is a dexamethasone suppression test may be administered for diagnosis. And if the child has syndrome, the plasma levels of adrenal cortisol will fall. Next is if it will not fall in children with adrenocortical tumors because the tumors continue to stimulate the adrenal glands to oversecretions. And if cosentropin, a synthetic corticotropin or ACTH is administered, plasma cortisol levels will normalize. And next is the ACT scan or ultrasounds reveal the enlarged adrenal or pituitary glands. For the signs and symptoms of this disorder, moon face, excessive hair growth, red cheeks, cervicodorsal fat pad, weight gain, pendulous abdomen, easily burst, abdominal stray, poor wound healing, and then thin arms and legs. So, ingani siya forma ang Cushing syndromes. So, nadiri ang signs and symptoms of the Cushing syndromes. So, next, the pancreas. The pancreas is a unique organ in that it has both endocrine, ductless, and exocrine with duct types of tissue. So, the islets of Langerhans form the endocrine portion. Alpha islet cells have the responsibility to secrete glucagon, and beta islet cells secrete insulin. So insulin is essential for carbonate metabolism, and it also important in the metabolism of both fats and protein. So it is formed from amino acid at a rate between 35 and 50 units per day in adults and proportionately less in children. So type 1 diabetes, type 1 diabetes mellitus. So type 1 diabetes mellitus is a disorder that involves an absolute or relative deficiency of insulin, which is in contrast or to type 2 where insulin production is only reduced. So for the assessment, increased thirst and urinations, bedwetting in a previously toilet-trained children. And then for the etiology, immunologic damage to islet cells in susceptible individuals, high frequency of human leukocytes antigens, particularly HLA-DR3 and HLA-DR4. Then family history of diabetes. So if glucose is unable to enter body cells because of lack of insulin, so it builds up in the bloodstreams, the hyperglycemia. When the kidney detects hyperglycemia greater than the renal threshold of 160 mg per deciliter, so the kidney attempts to lower it to normal levels by excreting excess glucose into the urine, causing glycosuria accompanied by a large loss of body fluid or polyuria. So excess fluid loss in turn triggers the thirst response or the polydipsia, producing three cardinal signs of diabetes: the polyuria, polydipsia, and hyperglycemia. For the laboratory studies usually show a random plasma glucose levels greater than 200 mg per deciliter, normal range 70 to 100 mg per deciliter, fasting to 90 to 180 mg per deciliter, not fasting, and significant glycosuria. And then fasting blood glucose test, random blood glucose test. And for the therapeutic management, insulin administration, regulations of nutrition and exercise, stress management, blood glucose, urine ketone monitoring. And for the other diagnostic tests, we have here the analysis of blood sample for pH, partial pressures of carbon dioxide, sodium and potassium levels with a white blood cells count, and glycosylated hemoglobin evaluation. So insulin administration, the most common mixtures of insulin used with children is a combination of an intermediate acting insulin and a regular insulin, usually in a 2:1 ratio or 0.75 units of the intermediate acting insulin to 0.333 units regular insulin, and given in the same syringe. Although these prescriptions varies for individual children. So the morning dose is 2/3 of the total daily dose. For injection technique, insulin is always injected SC except in emergencies, when half the required dose may be given IV. SC tissue injection sites includes those of the upper outer arms and the outer aspect of the thigh. So next, insulin pumps. An insulin pump is an automatic device approximately the size of an iPhone. So nutrition. In order to know how much insulin to give before a meal, parents need to learn to count the total carbohydrates amount in the food by carefully reading food's label. Most parents needs to meet with a nutritionist to discuss what a meal high in fiber means to become adept at carb countings and what meals are best to serve to their aged child. For the inhalations insulin is not available as yet but may be in the future. Productions of it is in experimental trials. So self-monitoring of blood glucose. So children as young as early school age can learn the technique of finger punctures and reading a computerized monitor. Using a spring-loaded injection pin helps minimize pain, and automatic readout monitors simplifies the procedures. The next, urine testing. So it is not used routinely but is used to test for ketonuria. If the child develops a gastrointestinal or flu and is not able to eat, acetone revealed by a test strip is a sign fat is being used for energy or the child is becoming acidotic. For the honeymoon period, the islet cells will begin to fail once again and diabetic symptoms will recur. Caution both the parents and the child that symptoms will be inevitably recur. For the stress management, try to interview children separately from their parents so they can feel free to talk about anything that may be happening or going wrong. So if a child is experiencing stress because of school, parents may have to meet with school officials to help them view the child as well. For the complication, if an infection occurs, the child's temperature rises, insulin's resistance increase, causing a need for additional insulin. Teach parents to notify their primary health care providers if their children appears to be ill, particularly if the child is nauseated or vomiting, for careful observations and a change in insulin dosage if necessary. So many long-term body changes such as arteriosclerosis, hardening of arteries wall, which can lead to general poor circulations and kidney disease, and thickening or retinal capillaries and cataract formations, which ultimately can result in blindness. Occurring becomes because of chronic hyperglycemia are not a major part of disease management in childhood because their onset does not begin until adulthood. So for the pancreas transplantation, for children who develop severe kidney disease or arteriosclerosis, pancreas transplantations may be considered to prevent further damage. So to reduce the child's immune response and protect against graft rejections, drugs such as antilymphocytes, globulin, cyclosporin, prednisone, or azathioprine are administered after surgery. If rejections occurs does start to occur, the patient is given monoclonal monoclonal or T-cell antibodies to reverse the process. So pancreatic transplantations is a last resort solution for children because it involves major surgery. Outcomes is guarded about 50% of transplanted organs are rejected and the result continuous immunosuppressive medications for life may not be regarded as a major improvement over the original illness which requires continuously daily insulin for life. So, mao ni siya ang table for the comparison of type 1 and type 2 diabetes. Naapod diri ang table for the acceptable blood glucose range for young children. Next, type 2 diabetes mellitus. So, it is characterized by diminished insulin secretion, is a separate disease from type 1 diabetes because it is not caused by autoimmune factors. With this type of diabetes, the pancreatic islet cells are still able to minimally functions. For the signs and symptoms, lessened amount of thirst or increased urination. About 90% of children with T2D have dark, skinny patches on the skin. So, we have here the table for T8.5, page 1366. So, we have naadra ang comparison of hypoglycemia and hyperglycemia. The next is the parathyroid gland. The four parathyroid gland located posterior and adjacent to the thyroid gland. So regulates serum level of calcium in the body by controlling the rate of bone metabolism through the secretions of parathyroid hormones. So for the disorder, we have here the hypocalcemia. So hypocalcemia is a lowered blood calcium level that occurs to some extent in all newborns before they begin sucking well. So for the assessment, hypocalcemia tends to occur in infants who experience birth anoxia. Immature infants and infants of women with diabetes tends to accompany the hypoglycemia that occurs in these infants after birth. Next is chief sign of hypocalcemia is neuromuscular irritability, referred to as latent tetany. And the newborn will demonstrate jitteriness when handled or if the infant has been crying for an extended period. And then for the management, treatment is aimed at increasing the calcium level in the blood above the point of latent tetany. The newborn who are having generalized seizures may require anticonvulsant therapy in addition to the calcium gluconate to the to half the to half the seizures. Next is phenylketonuria. So PKU is a disease of metabolism which is inherited as an autosomal receives threats. PKU is found in one of every 10,000 births. In the United States, it occurs rarely in people of African or Jewish ancestry. So PKU cannot be detected by amniocentesis as a routine screening measures because the phenylalanine levels does not rise in utero while the infant is still under the control of the mother's enzyme system. So recombinant DNA technique can be used for carrier detections and prenatal diagnosis from maternal serum. For the assessment, early identifications of the disorder is essential to prevent the child from becoming severely cognitive challenged. And for the management, dietary restrictions has been the main treatment of PKU for over 50 years and still remain the main therapy. Large neutral amino acids have been suggested as an alternative treatment to improve by the US Food and Drug Administration. Next is the maple syrup urine disease. So, maple syrup urine disease is a rare disorder inherited as an autosomal recessive trait in which there is a defect in metabolism of the amino acids leucine, isoleucine, and valine, which leads to cerebral degeneration similar to that observed in children with PKU. For the signs and symptoms, feeding difficulty, loss of the motor reflex, regular respirations, progress rapidly to epistotonus, generalized muscular rigidity, and seizures. For the management, if maple syrup urine disease is diagnosed during the first day or two of life and the child is placed on a well-controlled diet that is high in thiamine and low in amino acid leucine, isoleucine, and valine, cerebral degenerations can be prevented just as it can be prevented in PKU. So next is the galactosemia. So galactosemia is a disorder of carbonate metabolism that is characterized by abnormal amounts of galactose in the blood, and in the urine. It occurs in about 1 in every 60,000 births, most often as an inborn error of metabolism, which is transmitted as an autosomal recessive threat. For the assessment, appears as soon as the child begins formula or breastfeeding and includes lethargy, hypotonia, and perhaps diarrhea and vomiting. The liver enlarges as cirrhosis develops. Jaundice is often present and persistent, and bilateral cataracts develop. Untreated children who survive beyond this time may be cognitively challenged and have bilateral cataracts. Diagnosis is made by measuring the level of the affected enzymes in the red blood cells and then screening tests. For the management, placing the infant on a diet free of galactose or giving the child formula made with milk substitutes such as casein, hydrolysates, or Notramigine. Next is glycogen storage disease. Glycogen storage disease refers to a group of genetically transmitted disorder that involves altered productions and use of glycogen in the body. Glycogen is normally stored in the liver to provide a reserve supply of glucose. So when the body needs glucose for emergency, this glycogen is transformed back to glucose. So in children with glycogen storage disease, glycogen is deposited normally, but an enzyme deficiency prevents retransformations of the glycogen back to the glucose. So for the assessment, because the liver must store such a large supply of glycogen, it increased so much in size that the abdomen protrudes. So over a long period, the child growth will be stunted because there is only glucose available for energy, not for growth. Then, if hypoglycemic episodes have been served, brain damage may result. So for the management, children with glycogen storage disease needs to eat a high carbohydrate diets with snacks between meal to prevent hypoglycemia. Then a continuous glucose nasogastric or gastrostomy feeding during the night may be necessary to prevent hypoglycemia while sleeping. And then therapy with dioxazide and anti-hypoglycemia drugs that inhibits insulin release may help regulate the glucose level to prevent additional growth. And next is the Tay-Sachs disease. Tay-Sachs disease is an autosomal recessively inherited disease in which the infant lacks hexosaminidase A, an enzyme necessary for lipids metabolism. Tay-Sachs disease is found primarily in the Ashkenazi Jewish population. So, for the assessment, children generally appears well in the first few months of life except for an extreme moro reflex and mild hyponia. If left untreated, at 6 months of age, they begin to lose head control and are unable to set up or roll over without support. On an ophthalmoscopic examination, a characteristic cherry red macula is noticeable, caused by lipids deposits. By 1 year of age, children will be develop symptoms of spasticity and are unable to perform even simple motor tasks. By 2 years of age, generalized seizures and blindness will have occurred. And then last is children die of cachexia and pneumonia by 3 to 5 years of age. For the management, there is no cure for Tay-Sachs disease. So, thank you for listening. God bless everyone.